Okay, good morning, good afternoon, good evening po sa lahat-lahat ng ating tagapanood. Welcome to our 125th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us for today, welcome po at sana po masiyahan po kayo at marami po kayo matutunan sa episode sa ngayon. The pandemic is not over. We are still seeing changes in the behavior of the COVID-19 virus here and in other countries. However, increasing infection rates do not translate into more deaths from COVID-19. Nagiging mas magaling na po tayo. We are getting better in the pandemic response, but there's still a lot of room to act better and to improve upon. Vaccination, testing, treatment, ventilation, all of our overall efforts to protect people, they are now part of a larger like tool belt or armamentarium we can draw from in relation to COVID-19 prevention and control. However, recently, voluntary use of masks, with the exception of healthcare facilities, medical transport vehicles, and public transport, was announced in the Philippines. Marami na pong usap-usapan tukol dito. Marami din pong mga tao medyo naguguluhan, medyo confused. Voluntary po means people will need to decide for themselves kung kailan at saan po nila gagamitin ng mask, lalo na kung nasa public, if they are indoors, maybe kung nasa bahay man sila. So ano po ba? What is the best guidance on when to use or not to use your mask? I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday, and also looking forward to Fridays because I get to share hosting duties with our adjunct research faculty at the National Telehealth Center, also international renowned public health communications expert, Dr. Susie Pineda Mercado. Partner?
Hi, good afternoon, Raymond. I hope you're feeling better. Are you okay now?
I have my voice back, but it's a
Yeah, and
little hoarse.
energy.
Yes.
Oo, kasi medyo nagkasakit ng konti si Raymond. I think all of us have been under the weather for various reasons, but welcome everyone. We'd like to welcome everyone who's watching us in the Zoom. Welcome sa lahat ng mga suki. Nice to see you all here. And we also want to greet those who are watching on Facebook and on YouTube. Now, before we go forward, want to just let the YouTube listeners know that at 1 o'clock, we will be preempted by another event that TVUP will cover. So suggestion namin, we highly encourage you to shift to the Zoom. So punta kayo sa Zoom ngayon na, or you register in Zoom, then you enter the Zoom, or you can watch on Facebook. But at 1 o'clock, we'll be preempted on YouTube. Okay? So binabati na natin lahat ng mga nakikinig on the playback. Welcome to those of you who are watching, and also for those of you who are watching us on UP TV Signal TV Channel 101. Oo, yan ang ating channel sa TV, no? So we have really moved forward, and we'll be reaching a lot more people, and it's just thanks to you that you're all here so that we can be here to serve you. All right. In this episode, we have 3 experts, all right? Dr. Marissa Alejandria, immediate past president of the Philippine Society for Microbiology and Infectious Diseases, or PISMID, currently the chair of the UP Clinical Epidemiology Unit. And she will tell us about the basic principles to keep in mind to protect yourself and others using the mask. We also have one of our leading pulmonologists at the Philippine General Hospital, Dr. Ralph Elvi Villalobos, who will be giving a quick reaction. And one of our favorites, Dr. Anna Lisa T. Ong-Lim, who was with us last time, but we're bringing her back to talk about masking and children. All right. So at the end, we will have closing remarks of our Deputy Director for Health Operations, Dr. Stella Marie Legaspi Jose. Okay. So maganda. Marami tayong pag-uusapan, and we will try to provide as much clarity and good information for you on to mask or not to mask. And as you know, in our opening billboard, we say it's Stop COVID Deaths, but we do tackle other topics like infections, viruses, disasters, but we are still focusing on COVID. And today we are focusing on COVID. Now, we also know that you are all very keen on learning what the latest news is, both here and abroad. And it's for this reason that we bring you the news update.
Okay, for our very first news update, Paxlovid may reduce risk of long COVID in eligible patients. So meron pong pag-aaral, no? The research look at patients who qualified for the antiviral Paxlovid through age or health conditions. Ang napansin po nila, those who took it shortly after infection, they were 26% less, a little over 1/4 less likely to have symptoms 90 days after. So pag nag-Paxlovid pa kayo, parang mukhang hindi na kayo or mababa yung chances na magkakaroon po kayo ng long COVID. The findings suggest that for people who are medically eligible, I repeat, medically eligible lang po ang dapat po kumuha ng Paxlovid. It not only reduces the odds that they will be hospitalized or die from coronavirus infection, but also lowers the risk of long-term infection. So hopefully this is something that mas mapag-aralan pa po, and we'll keep an eye on this as we move along. Dr. Susie?
Yes, so in our second news item from the British Broadcasting Corporation, lab-grown blood is given to people in the world's first clinical trial. So blood that has been grown in a laboratory has been put into people in a world first clinical trial, according to researchers of the United Kingdom. The process takes about 3 weeks, and an initial pool of around 500,000 stem cells results in 50 billion red blood cells. These are filtered down to get around 15 billion red blood cells that are at the right stage of development to transplant or transfuse. So this is a very new technology that's being developed in the United Kingdom. And that's our news for today. We'll be bringing you more news next week on the News Update. Okay, tuloy-tuloy tayo, Raymond, no? We have we are very excited about this topic. I think there's a lot of discussion around when and where a mask should be taken because it's voluntary. No, so nasa sa atin, no, kung kailan tayo gagamit ng mask. So kailangan mataas ang antas ng kaalaman natin, lalo na sa frontliners, kasi baka maraming nagtatanong sa inyo, Doc, kailangan ko bang magmask, o do I have to get my kids or my family members to wear a mask? So we are bringing you, as you heard, the best experts for the day to talk about this. And okay, so Raymond, I think we'll do housekeeping right now.
A little bit of housekeeping po, no? So for those who are asking, certificates of attendance have been already sent out up until webinar 1, 2, 3. Meron pa rin po kaming konti na lang po na natitira for webinar 1, 2, 4. But if you feel you should have received it because you attended at least 50% of the webinar duration but did not receive anything, please email us at stopcoviddeaths@up.edu.ph. So we really would want every one of you to let us know if you have any questions po. Please put them in the Zoom. If you have any questions, lalo po sa YouTube or Facebook, please let us know para rin po malaman po natin kung may mga makita po tayo doon na pwede po natin tanungin sa ating mga experts. But for today's webinar, medyo mag-iiba lang po tayo ng format for today. So we'll still have our speakers present. So our main speaker and then the reactors will give their insights. Then we will proceed with what we are calling, medyo bago pong pakulo, Ask the Expert. Pakinggan ang mga tanong ng taong bayan. So instead of the person on the street interview, we have asked ordinary people what their questions are on masking as they go about their everyday lives. But before we go into the webinar proper, we have this cute intro video for our fun quiz segment.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you. Thank you, TVUP. It still tickles our fancy kapag nakita po namin yung ating animated video that we have today. Okay, so for those in the Zoom, makita nyo po, may lumabas po na polls/quizzes po na window. But for those who are outside of the Zoom, maybe in YouTube or Facebook, please open up your browsers, type in slido.com, and enter the code 5405717. That's 5405717 for you to be able to participate in our fun quiz segment. For our first question, meron lang po tayong dalawang katanungan for today. Ano-ano pong sitwasyon, what situations call for wearing a mask in the community? Is it letter A, kung kayo po ba ay elderly? Number 2, kayo po ba ay immunocompromised? Number 3, kung meron po kayong comorbidities. Number 4, kung hindi po kayo bakunado against COVID-19. And then number 5, kung meron po kayong sintomas. So we'd like to greet those who are joining us all the way from, ito po medyo bago to Sumajit Salamida Eye Clinic in Rojas, Isabela, from Ong-Lim Medical Center in Apalit, Pampanga, Occidental Mindoro State College in San Jose, Occidental Mindoro, West Negros University in Bacolod, Negros Occidental, and Mayor Hilarion A. Ramiro Sr. Medical Center in Osamis City, Misamis Occidental. Meron din po mga nakikibate, lalo po galing sa UPIS. So thank you po those who are joining us from the Midwifery Department of Occidental Mindoro State College, from the Air Force City Hospital. Uy, bago yun. Sa Pampanga po ito. Those joining us from Rizal Medical Center, from the Ward 1 Department of Internal Medicine ng UPPGH, from the Quirino Memorial Medical Center Laboratory, New Sinai School and Colleges, from UP Diliman, the House of Representatives. Maraming salamat po. May mga dentist din po na sumusubaybay at nanonood po ng ating episode for today. There are those coming in, especially, hindi po natin makalimutan yung ating regulars from Alicia South District Schools Division of Isabela in Regional Office of Tuguegarao, DepEd Central Office, Philippines po. Maraming salamat. Joining us all the way din po from, I think, UP Los Baños. Meron din po from One Bataan. Medyo marami po tayong taga-Occidental Mindoro for today. Thank you so much. Those coming in from UP Diliman Office of Counseling and Guidance. Thank you po. From the PGH Department of Obstetrics and Gynecology from Quezon City. Those from Morong Rizal. Those from University of Rizal System Health Services Unit in Morong Rizal, from Iloilo City, from Osamis City, and Camarines Sur and Marilao, Bulacan. Maraming salamat po sa inyong lahat. And for question number 2, we have what are the best practices for prevention of respiratory infections in schools? Meron po tayong several choices. Choice 1, good airflow. Number 2, open windows. Number 3, proper positioning of electric fans. Number 4, no crowding. Number 5, stay home when sick. And number 6, sneeze and cough etiquette po. I'd like to greet those, medyo may mga pahabol. Locally, Amang Rodriguez Memorial Medical Center, and also those from EDC Clinic, Bachman Geothermal Projects in Albay and North Fairview, Quezon City. Internationally, meron din po from MISJ Jakarta, Indonesia. Maraming salamat po. Those from Chonin Hospital in Taipei City, Taiwan, Bangkok, Thailand, from the Rejang Ear, Nose, and Throat Specialist Clinic in Cebu, Malaysia, Sarawak General Hospital in Kuching, Malaysia, Mentari Intercultural School, Jakarta, Indonesia, Nguyen Thai Hoc Polyclinic in Vietnam, Qasim University Medical City in Saudi Arabia, Lunichi Ali University of Blida II in Algeria, the University of Ha'il in Kingdom of Saudi Arabia, and St. Augustine's Catholic Primary School in Tunbridge Wells in England. So maraming salamat po. We will not be closing our fun quiz, and we encourage everyone, as mentioned by Dr. Susie, dahil po mamaya pong alauna ay mawawala po tayo sa YouTube. So we hope that those who are in YouTube they will be logging in, registering and then logging in dito po sa Zoom kasi po mamaya pong 1:00 that will be shifted po to the search for the next UP President. But we will be continuing with our webinar. Tuloy-tuloy lang po tayo. Pero nandito lang po tayo sa Zoom. Okay? So, take it away, Dr. Susie.
Raymond, nasa Facebook din, di ba?
Yes po. Yes po.
Yeah, so you can go. So if you're watching on YouTube, go to Facebook or go to the Zoom. Para tuloy-tuloy din nyo din mapanood.
Yes
Okay.
po. Yes po.
No, yeah. So I know we're excited to get this on the way, and our speaker is a familiar face. She was one of the first speakers of Stop COVID Deaths. Back in the day, 2 years ago, 3 years ago. Ang tagal na, Raymond, ano? At that time, we didn't know really how to go, but she was the head of the clinical trial for several treatments under the WHO. What was that called nga, Raymond? Yung WHO trial?
Solidarity.
Solidarity trial. So maaga pa lang, kasama na natin to. She's very much in demand as a speaker, pero tuwing inibita natin, ay talagang pinauunlakan naman tayo, no? Si classmate ko kasi siya. Sige. So, she's really in demand. She explains very clearly. She's a member of the DOH Technical Advisory Group. Let's give a warm welcome to the director of the Institute of Clinical Epidemiology of the University of the Philippines National Institutes of Health, Dr. Marissa or Isa Alejandria. Welcome, Isa. Welcome back.
Yep. Good afternoon, classmate.
Oh, yun na nga. Dito na naman tayo. Sige, go ahead, Isa. Inaantay ka nila. Go ahead.
Yeah, happy to be back here, and good afternoon, no, to our virtual audience across the country and globally. Yeah, maraming salamat sa pagdalo. Okay, so let me share my screen. Okay, so yeah. You can see my screen now, no? Okay. So the topic given to me is to mask or not to mask. So this is the question that we will answer in this webinar, and I'll start off with the answer. Our answer is yes, we encourage everyone to continue to wear masks indoors. Why? How do masks protect us? Who should wear masks? This is what we will discuss today. Okay. But before I go to that, let me just give a context, no, of where we are, no, in the COVID pandemic. Okay. So that we know that the cases are decreasing. No? There's a declining trend in the number of cases, and the deaths also have significantly decreased. No? So both globally and locally, and the infection fatality ratio is now down to 1 to 2%. Okay. However, we know that variants still continue to emerge. So we've heard about the emergence now of XBB, XBC, BQ.1. So these are the descendants of BA.5, which is now the predominant variant, which is still under Omicron. No? So ito yung mga anak ni Omicron. And we've seen this being reported also in our country. But we know that our vaccines, no, remain effective in preventing hospitalization and death. But they are not effective in blocking transmission. No? And our variants, no, as we've seen the Omicron variant, it has the presentation is much different compared to our Alpha and Delta variants last year. No? This variant is more transmissible, highly transmissible, but the cases are predominantly mild, especially among those who are vaccinated and boosted. So that's our setting, no? And we also know that with regards to vaccination rate in our country, the primary series were about 70%, but our booster coverage is still less than 50%. It's still low, no? So we need to boost our boosting coverage. So with that, no, we've seen that the emergence of variants means that transmission is still ongoing. No? So the virus is able to mutate because there is still transmission. And in terms of science, no, we've seen that the context has changed now with regards to the status of our cases, no, and then the emergence of variants. But in terms of the science of transmission, the mode of transmission of COVID still remains the same. No? So person to person is still the predominant mode of transmission, mainly via these respiratory droplets, no, which can enter through the eyes, nose, or mouth. So the mucous membrane, especially with activities such as coughing, sneezing, singing, talking. No? So these are the activities where transmission is highest. No? And then we also know that the virus can be aerosolized, no, into fine respiratory droplets, especially in areas, enclosed spaces where there is the airflow is not that good or the ventilation is not good. So these virus particles can aerosolize and be airborne. Then you can also get COVID if you touch your mucous membranes with your hands that have been contaminated, no, with virus particles or contaminated surfaces, no, that with the virus. Okay, so the mode of transmission remains the same despite the highly transmissible variants. So again, with that setting, while if the cases are decreasing, there are still variants that are highly transmissible. There is still benefit, no, in wearing masks, especially indoors. So how do our masks protect us? Okay. So masking, no, works two ways. It can reduce the emission of virus-laden droplets by the wearer. So it serves as a source control, no, to block exhaled virus. If you are the one who is infected, okay, so the mask will prevent the spread of the droplets, no, when by the one wearing. And then on the other hand, among those who are healthy or who do not have symptoms, the mask will reduce inhalation of droplets, no, by the healthy individual. So it protects both the infected individual, it prevents the spread, no, of the virus from the infected individual, while the healthy individual is protected from inhaling, no, the droplets of symptomatic individuals. So these two, source control and filtration, they work together, no, synergistically, and this benefit increases with increasing numbers of people using masks correctly and consistently. So masking has both a community benefit because it protects both the healthy individual and the symptomatic individual, and it has also an individual benefit. And as more people wear masks correctly and consistently, then you increase the benefit. And additionally, wearing of masks does not have side effects. No, it does not have any adverse effects. It's generally safe to wear masks. It does not affect our respiration, no, your breathing. Okay, so it is totally safe, okay, to wear mask. And then there are now a lot of studies, no, experimental and epidemiological studies showing the benefits of masking. Just quickly go through this in the interest of time. Like one clinical trial in Bangladesh showed that surgical or cloth mask, role modeling, and active mask promotion increased mask use by 42%. And in villages that received masks, the prevalence, no, of symptomatic COVID was reduced by 9%. Okay. In another study in a cruise ship, wearing of face coverings reduced the risk of infection by 70%. And then in another household study in China, wearing mask by the index patient and the contacts reduce secondary transmission within the households by 79%. And there are a lot of studies in the US and Europe that cross-sectional surveys which show that universal masking in the community reduce infections, mortality, hospitalization, growth rates, and even an economic analysis using data showed that universal masking can prevent the need for lockdowns and reduce economic loss. Okay. So how do we choose our mask? No, we have seen the benefit. So make sure that the mask that you choose, whether it's surgical or a cloth mask, is a mask that will fit you. No? So pick a mask with multiple layers to keep your respiratory droplets in and the respiratory droplets of others out. So choose a mask with a nose wire to prevent the air from leaking out of the top. Okay. Our guidelines, in the Philippines, the local guidelines also recommend the proper use of a well-fitted cloth mask or medical mask, in the community. And if you are going to use a cloth mask, it's suggested that it be made of at least 2 layers of cotton or non-woven nylon, and again with an aluminum nose bridge. Okay. Now, who should wear masks? So it's a dictum that once you are not feeling well, you're starting to have some colds, cough, or sneezing, you should wear mask. So, and then if you are immunocompromised, you're a cancer patient receiving immunosuppressive drugs, elderly with comorbidities such as diabetes, TB, chronic pulmonary disease, or if you're living with someone who is an elder, a senior citizen with diabetes, heart disease, kidney disease, or immunocompromised with malignancy, ongoing chemo, or you are unvaccinated, or you are going to crowded areas or in an enclosed space where you are not able to maintain a physical distance, or where you are not sure of the ventilation, then you should wear masks. So these are all the conditions on who should wear mask. Okay. And the reason for that is it has been shown also in several studies that age is an important risk factor for severe COVID-19. So the older you are, the higher risk for severe COVID-19, and the presence also of other disease conditions, like cancer, lung disease, heart disease, and if you are pregnant or unvaccinated, then your risk for severe COVID-19 also increases. So that is why we recommend that these groups of people should wear masks. Okay, and then in what settings also are you that we recommend to still continue to wear masks? So if you are riding in a public transportation, so by air, so in an airplane, by bus, by train, a high quality mask is recommended, as it will protect you and those around you. Because in this setting, in a public transportation, you're not sure of the ventilation system of the transportation, and then if you are not able to maintain distance, or if there is crowding, then it's best to wear mask in public transportation. Now, how can we improve ventilation at home or offices? So aside from wearing masks, we advocate for improving ventilation, especially now that the policies are being eased up, and it's being said that indoor masking is now voluntary. We would like to advocate that we improve or implement standards to improve ventilation at our home and our offices. So how can we improve ventilation? So you can use electric fans to improve airflow. And where should you position it? It should be placed as close as possible to an open window blowing outside to help get rid of virus particles. So even without an open window, the fans can still improve the airflow. And then position it away from people. So pointing the fan towards people can blow contaminated air directly to them. Ceiling fans can also help improve airflow, whether or not windows are open. Then you can also consider using portable air cleaner and turning on exhaust fans, no, especially if you have gatherings, no, in your home or offices. Okay. Then the same thing goes with the schools, no. The ventilation system should be good in such a way that there is good airflow. So you can do that by, again, opening windows, using portable cleaners, and then ensuring also that these children, no, are not crowded in the classrooms, no, and help the children also wear masks, no. So 2 years and above, they can wear masks already. Okay. Yeah. And good ventilation is actually very important to consider in areas where students may not be able to wear masks. So when you're eating, no, so eating meals outside is best. If you need to have students eat in a cafeteria, then open the windows, okay, and then provide again portable air cleaners, okay, and then maintain distance. And then when you're riding the vehicle, opening the windows a bit, no, can help improve ventilation. And then just to cite one study, there are a lot of studies on schools, no, showing the benefit of masking. This one just came out 2 days ago. This is a study conducted in Boston, wherein they look at the incidence of COVID-19 in schools before and after the statewide masking policy was rescinded. Okay, so this study showed that among school districts in the greater Boston area, the lifting of masking requirements was associated with an additional 45 COVID-19 cases per 1,000 students and staff during the 15 weeks after the masking policy was rescinded. No? So the graphs here, no, shows that those who lifted the masking, no, in the first week when the policy of lifting mask was implemented, those who followed the order right away had higher number of cases here. Yeah, the blue line. While though there were 2 schools that sustained masking, and it was shown that their number of cases were much lower compared to those who lifted masking. Okay. Now I'll just go through some of the factors that can lower or increase the risk of transmission. Okay. So these are questions, no, factors that you will consider to help you come up with an informed choice or decision whether to wear a mask or not, no. And one factor is the length of time, no, that you are exposed. Or the questions here are in past tense. It helps you assess if your exposure to an potentially infected person is low risk, moderate, or high risk. Then these questions can also be in the future tense, no, in your future interactions. By asking this question, how long will you be in contact with another person, no? Or how long will you be in close contact with another person in a certain activity? For example, if you are going to attend a party, how long will you be in that enclosed space, no? So the longer the exposure time, the higher is the risk of transmission. So contact longer than 15 minutes or interaction longer than 15 minutes is more likely to result in a higher risk of getting the infection compared to, let's say, 2 minutes of contact. Then if the person is coughing, singing, shouting, then the risk of transmission is also much higher, no? Because respiratory droplets, no, are exhaled, no, once they start coughing, singing, or shouting. Okay. Then presence of symptoms also. So were you exposed to an infected person who had symptoms, no? So those who have symptoms transmit the virus, transmit a higher viral load, and you are at a higher risk of getting the infection if you are exposed to someone who is symptomatic compared to someone who does not have symptoms. Okay. And then is the person wearing a mask, no? So in the gathering, for example, are the persons there wearing masks, no? So if one person was wearing a mask, the risk of transmission is decreased. If both of you are wearing masks, then the decrease in risk is doubled, no? Is substantial. And then the risk is also lower if the mask or respirator type, no, is offering greater protection. So like KN95, medical mask, cloth mask. But the other factor is if it's well fitted, no, then your risk is also much lower. No? So it's not just the type of mask, but also if it's well fitted. Okay. And then if both of you are wearing it, then lower risk of transmission. Then another factor is the ventilation. So we discussed this earlier. So how well ventilated is the space? No, is the area where you're going. Okay. So more outdoor air can decrease the risk of transmission. So outdoors, lower risk compared to well ventilated indoors, and the highest risk is in poorly ventilated indoors. Okay. And then we've shown you how to improve airflow. The next is distance. Okay, are you able to maintain a sufficient distance, no, in any gathering or even a place where you're going? So being closer to someone who is infected with COVID-19 increases the risk of transmission. So crowded settings can raise the likelihood of being close to someone with COVID-19. Okay. So yeah, so those are the factors, no, that can help you make an informed choice and guide you in assessing your risk. And then this is a infographic, no, a local version from our Department of Health, again on that can help you assess, no, your risk and whether you should, whether it's safe to remove your mask or not. So it takes into account if you're vaccinated, konti lang ba ang tao sa lugar, kaya mo bang dumistansya, open air ba, madalas ba maghugas o mag-sanitize ng kamay ang mga tao. So these are factors. So if you answered X, no, you are not vaccinated, you are unable to distance the you're not sure of the ventilation, then it's best to wear a mask. And this is another set of questions to assess risk, no. Minsan lang ba ako nakikipag-usap at nakikisalamuha sa iba't ibang tao, no? So this is your assessing your risk of getting the infection. So in your activities, are you engaging in close interactions? How long are your interactions? Do you go to crowded places? And then are you living with someone who is at high risk, no? Senior citizen, pregnant, or someone who is with comorbid conditions wherein you can potentially transmit the infection to these individuals with weak immune system. So these are some guide questions. Okay, so here I'm just summarizing now the preventive actions, no, available to us to protect ourselves, our family, and the public. Okay, so again, get vaccinated and boosted to prevent hospitalization and death, to prevent severe disease, no, and continue to wear well-fitted masks indoors and in crowded areas, as this will protect you from the virus and its variants. Okay, and if you are sick, stay home, get tested. So practice cough etiquette. Okay, so cover your cough, no, when sneezing or coughing. You can sneeze on your sleeves if you do not have tissue or you are not wearing masks. Then no, Okay, so always do hand hygiene. So wash our hands with soap and water, especially with touching surfaces, and then disinfect high touch surfaces regularly. Avoid crowds, poorly ventilated spaces, and maintain physical distance as much as possible. Okay, so there we go. So wearing of mask is an individual informed choice. Since it has now been announced that it's voluntary. So it's when you now need to empower yourself to be able to assess your risk for every activity that you're going to do. Okay, so hence and summarize this statement from HPAC. This is our statement in response to the voluntary indoor masking mandate. So we still highly recommend everyone to continue masking. So wearing mask is a simple, practical, effective way to prevent transmission of COVID-19, and it can prevent transmission of other respiratory diseases as well. Not just COVID, but influenza, pneumonia, TB, chronic respiratory diseases. We've seen actually during the pandemic a decrease in the incidence of these other respiratory infections. So hence, we highly recommend everyone to continue masking, especially if you are elderly, immunocompromised with comorbids. You are in close contact with these groups of people, elderly, immunocompromised with comorbids, or you are in an enclosed space or a crowded outdoor space, whether it's for work, travel, or leisure. And again, as the policies on masking so we would like, we recommend also that we ensure safe ventilation in the workplace, at schools, and public transport. So we urge the government to really implement these standards, to place a high premium on measures addressing crowding, air quality. There are standards for air quality and crowd management through engineering and administrative controls, and this should be part of our new normal. So I'd like to end and say that public health is a shared responsibility. Let us all work together for safe, COVID-proof, disease-proof environments. Thank you.
Oh, thank you very much, Isa. Ang ganda talaga ng presentation ni Isa, kaya talagang in demand din si Isa. In fact, Isa, I have some people here who are, thank you, okay. Some messages here asking if they can get a copy of the PowerPoint. I guess we could share that, Isa, right?
Sure. Yeah.
Yeah, we can share the email, the PowerPoint presentation, kasi actually itong mga humingi sa akin are from schools. So I think, there's really a desire to have a very simple, straightforward presentation as Isa has done. So thank you so much. You'll see the appreciation of our audience, both in the form of the emoticons and the comments. So we're going to hear more from Isa later. Thank you so much. Raymond, over to you.
Thank you, Director Isa, and thank you, Dr. Susie. So malapit na po mag-alauna, we would like to take this opportunity for the very last time to remind everyone, lalo na po nanonood sa outside of the Zoom, in YouTube in particular, please try to register and log in sa Zoom po, because mamaya po mag-switch over ang ating TVUP YouTube channel to cover the search for the next UP President. Pero dito po sa Zoom, sa ating Stop COVID Deaths webinar, tuloy-tuloy lang po tayo, but we want you to be able to have that continuity of experience, so that we encourage everyone to register and then log in dito po sa Zoom para tuloy-tuloy po ang inyong panonood. We also would like to remind everyone that we will choose from among the questions yung pong upvoted and interesting questions for the ones that we will post to our excellent lineup of speakers po. Okay, it's my pleasure to introduce to you our first reactor. He's a consultant with the Division of Pulmonary Medicine at the UP Philippine General Hospital. Please welcome again to your screens, Dr. Ralph Elvi Villalobos. Dr. Ralph.
Good afternoon, Doc Raymond. Good afternoon, Dr. Susie. Thank you again for inviting me to be a reactor. No? So I was instructed to give a very short reaction on my thoughts and on today's discussion, especially this very perennial topic no, na parang pinag-usapan nito all the time about the benefits and disadvantages of wearing a face mask. So I will be sharing personal thoughts and some research on this issue. So wala akong slides. I listened. We had a very comprehensive talk with Ma'am Isa's presentation, and I will be siguro adding on some points lang as a pulmonologist regarding this topic. So I'd like just to reiterate no the arguments and the points no that regarding the advantages of wearing face masks. So I'll reiterate some points as raised by Ma'am Isa. So number one, really there is overwhelming evidence. No? So ever since pa siguro the COVID, there is already evidence, and this evidence is very huge that wearing face masks really decreases transmission rates of various respiratory illness. So we have to remember that it's not just COVID that is being protected from by wearing face masks. No, so this was explained thoroughly by Doctora. So the COVID virus is really transmitted by person to person, droplet, and airborne. And what's important to point here is that there is documented evidence that even asymptomatic persons, so I think it's very important for us to remember that even asymptomatic persons can transmit the COVID virus to the others or other respiratory illness virus to the others. So it's important that even we don't feel something or even if we don't feel anything bad, we wear it. We wear face masks, especially if we are, Dr. Isa has mentioned, we are near someone who might be at risk for severe COVID, the elderly, the immunocompromised, the unvaccinated people. So again, we must remember that using face masks does not protect us only from COVID. It can also protect us from other respiratory infectious illness, no? So meron tayong influenza, pneumonia, and all the other viruses. But I think from a pulmonologist point of view, since we're also dealing with air pollution, with asthma, with COPD, with the triggers, no? I see a question in the chat box, sabi niya, or a comment in the chat box actually, no? So I'm sorry, I'm preempting that. Luminis daw yung phlegm niya, hindi daw nag-trigger yung asthma. And in practice, we have seen a lot of cases and patients who actually do improve. No, their asthma has improved, their COPD or their emphysema has improved by just wearing a face mask. No, so that question will be or that issue will be very relevant, especially us and nagko-commute yung mga tao. The pollution level in the metro is very high. So I think more than just protecting us from COVID and other respiratory illnesses, wearing a face mask has also a lot of other benefits. So I think that's important to remember. So as I was reading some research, there are really some arguments. No, so I think I'll deviate some on what Dr. Isa said. There are some arguments that points against the use of the face mask naman. So these arguments, by all means, are not meant to discourage the use of face masks, but I think these are some points of improvement and education to our public health measures, educate our lay people, educate our other healthcare workers. No, so some 2 points lang. So again, the use of due to the changes in the behavior of the virus, that the mask there might be a false sense of security to the wearer. No, so as reiterated by Ma'am Isa kanina, there is evidence that mask effectiveness decreases with the Omicron variant. And so the wearer might think that the mask wearing is sufficient protection already, no, and won't adhere to the other health measures. So ito yung common misconception ng mga tao eh. Magmamask ako but I won't distance myself. I'll still go to crowded places, Baka it's giving us a false sense of security lang. So I think it's very important point that for us to discuss and to educate our people. No, it's not enough. Masking is not enough. It's just a part, as Dr. Elisa mentioned earlier, it's just a part of the other armamentarium that we have: vaccination, distancing, hand washing, and all these public health measures. So we have to understand that. And that's one of the points that I'd like to raise. And in the other hand, as a pulmonologist, there are fake news or some evidence that says that wearing mask might actually harm an individual, and this news or this evidence or research are spawned by individuals that will create fake news out of these researchers, no, and might say that hindi safe yung pagmamask. So they might use this evidence to persuade other people not to wear mask anymore. I have to reiterate, Ma'am Isa, that wearing mask is actually generally safe, no, for most individuals, but there has to be some caution then in some patients who have predisposition for respiratory disease, like those with severe COPD. Siguro we have to individualize our education to the mask, to the people who should wear masks, that it's not like a one size fit all, no, na hindi lahat ng tao should be given this kind of mask, no. So we have to get caution, especially those with very severe respiratory illnesses. We might have to caution them against wearing respirators, N95 or K95 or valve respirators, because they actually can have aggravation of their pre-existing condition. So yun lang. I think the bottom line here is that it's very important for the physician to talk about the patient, to educate about the benefits and the risks of a particular mask. No? So it's not one size fit all. We should educate them about the proper way of masking, the proper way of wearing it, what type of mask they should wear. And I'd have to echo again what Ma'am Isa said, that wearing a mask is really a voluntary informed choice. It's really you talking to the patient that you should wear this, when should you wear it, and when you can actually, there are situations that you can take off your mask. So yun lang po ang aking reaction. Might be short, and thank you very much again. I'd like to answer questions later on. Thank you.
Yeah, thank you so much, Ralph. Wala ba tayong palakpakan dyan? Meron. Thank you. Short but sweet and spoken, from the point of view of a pulmonologist. I thought that was also very, very enlightening for us. All right, our third resource person is also giving a reaction. We had her as a main speaker last week, but she was saying she had so much to say about this, so we're bringing her back to do a reaction. One of our favorites, one of your favorites also. She's recognized in our community as one of the best communicators of the pandemic. Dr. Anna Lisa Ong-Lim. Anna, take it away.
Thank you, Ma'am Susie, and good afternoon, everybody. Thanks for having me back. No? So, tama-tama nung pinag-uusapan natin nakaraang linggo, yung mga layers of protection. Ito na naman, nung pinag-uusapan natin, masking. And in the same way that we recognize that in all other settings, multiple layers improve success. In schools, this is also true. No? So kung ano man yung na-experience na natin sa iba't ibang settings within the community, like our workplaces, for example, no? Sinabi natin nung bumabalik na tayo sa ating mga workplaces na meron tayong mga behaviors na kailangang ma-implement to improve our chances of success and protection against infection. So in the school setting, ganun din naman, no? Hindi naman masyadong naiba ang mga recommendations. No? Nandiyan yung ventilation. So in the school setting, there might be particular attention paid to making sure that temperature control is achieved at the same time providing ventilation, kasi lalo na sa urban settings, marami din sa mga eskwelahan na air condition to manage noise and heat. So kung ikaw ba ay school, paano mo ngayon i-optimize yung requirements to control temperature while at the same time improving your ventilation? That's a very critical question to answer. Alam din natin na sa mga schools, maraming fairly crowded classrooms, no? Maraming learners, hindi karaniwang sapat ang space, but on the other hand, importante pa rin to make sure that there is attention paid to physical distancing. Yung ating usual hygiene measures of hand washing need to be in place. And likewise, a very huge paradigm shift for schools is really the mindset that hindi na tayo kailangan, or rather, hindi tayo kailangan mahiya or matakot na magsabing hindi ako papasok kung hindi maganda ang aking pakiramdam. So that goes for both the students and the staff. No, I think this is something that we all need to be reoriented about, kasi ang ating pag-iisip dati is kahit na kailangan ko mag-swimming sa baha, basta may pasok ako. So hindi pwedeng ganoon ngayon, no? Lalo na kung may nararamdaman tayo. It goes without saying, of course, that vaccination is critical. But our topic for today is masking, no? Which Dr. Isa has already explained very well. So sa school settings, bakit ba inirekomenda ng Philippine Pediatric Society at Pediatric Infectious Disease Society of the Philippines ang paggamit pa rin ng mask in indoor school facilities? This statement was released very recently, and in this particular statement, there was a recommendation that wearing of face masks include, together with all of our other infection control recommendations, need to be continued in indoor school facilities to prevent transmission. So ano-ano ba yung mga dahilan na ipinakita or shared in this particular policy statement so that the public can be guided? So unang-una, the group took note of the fact na marami pang kumakalat ngayon na sakit, kasama na rin ang very transmissible Omicron, VOC, and its subvariants. And because this is so transmissible, hindi tayo pwedeng umasa sa isang strategy lamang para makaiwas sa transmission. So using all of these layers that I already mentioned previously will help to prevent transmission in school settings. Pangalawa, although sinabi nga natin na we encourage everybody to be vaccinated, hindi nga mandatory ang vaccination. And we have to recognize the fact na marami pa rin sa mga bata ang hindi bakunado. Or kung sakasakali man ay naka-receive lamang ng primary doses at hindi pa nabuboost, or meron actually tayong age group na hindi pa pwedeng mabakunahan. So our under 5-year-olds still do not have any vaccines available. So we still have a significant number of unvaccinated children in the school settings, and they remain susceptible to the disease. We are reminded, of course, that because in certain settings, physical distancing cannot be maintained, correct and consistent mask use can be important. And another point that was raised by the team was that kahit na ang ating common observation is for COVID to be fairly mild in kids, tatandaan natin na meron ding mga komplikasyon na o-observe sa mga batang nagkakaroon ng COVID. Hindi kailangan maging symptomatic ang COVID at hindi nga kailangan maging severe ang COVID para maging komplikasyon para sa mga bata. Meron tayong mga nakikita na nagkakaroon ng MIS-C or Multisystem Inflammatory Syndrome in children na wala man lamang history of symptomatic COVID, or kung meron man, it was so mild na hindi halos napansin ng mga magulang. Layered prevention strategies, finally, are also recognized to be important in controlling the spread of other respiratory and infectious diseases. So alam naman natin na pag nagsimula na ang pasukan, para yung it's a petri dish, no, of viruses and bacteria. Pag nagsama-sama ang mga bata, madaling-madali ang hawaan, and madalas nating mabalitaan ng mga kung ano-anong clustering and outbreak of illnesses. So kung tayo ay gagamit ng mga mask, hindi lamang tutulong para sa COVID, it's also helpful in preventing the spread of other infections. And this has already been observed in the community setting. Nakita na medyo nabawasan ang transmission ng iba't ibang mga respiratory infections nung panahon na tayo ay nagdi-distance at nakasuot ng mask. So may mga concerns that we have to recognize, as Dr. Ralph has also mentioned, and in particular in the school setting, yung communication issues, maaring hindi magkarinigan ng maigi dahil nakatakip ang bibig ni teacher, no? Or nagre-recite yung bata, hindi siya masyadong maintindihan. Syempre, factor din yung impaired face recognition and identification, pero it's so amazing that people can recognize each other so well behind masks, na nasanay at natuto na rin tayo. And the other thing siguro is blocked emotional signaling, because di ba, parang we depend on visual cues to be able to read how other people feel as we communicate. And these are things that have to be recognized. But in the current scenario, where we have not yet optimized other engineering and administrative controls, as Dr. Isa has already mentioned, and where the rates of transmission are still fairly high, and where we are still just transitioning into the face-to-face MILUV after almost 2 years, maybe it's wiser to just take it one step at a time so that we can control these factors more readily. Thank you.
Okay, thank you very much, Ana. Nako, as usual. Palakpakan natin. As usual, very clear, way to the point, at talagang explain Tagalog, no? Maraming nag-comment nga last time na na-appreciate nila that you were speaking in Filipino. Okay, so thanks, Anna. That was really great. Okay, so we are going to move towards our new section, which Raymond's gonna explain in a bit, but we're gonna ask our speakers to please switch on your videos. So Isa, Ralph, and Anna, please switch on your videos. And while you're doing that, we're going to go to our public service announcement through TVUP.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpi-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh, natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para mapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much,
very much.
TVUP. The COVID
Go ahead.
Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 and above. We hope you'll share this video clip in all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. So today, Dr. Susie alluded to this one. Meron po tayong medyo pumalit po sa ating person on the street interviews, and ang tawag po sa ating bagong segment na ito is Ask the Expert. Pakinggan ang mga tanong ng taong bayan. So dito po usually instead po of having someone really relay their experiences, meron lang po tayong mga specific na mga katanungan na ating itatanong sa ating mga experts po, no? So let's hear our very first question.
Ang gusto ko po itanong kung safe po tayong lumalabas na walang mask kasi yung iba sa jeep or sa kahit sa ang park hindi na sila nagmamask.
Doc, tanong ko lang is bilang commuter sa mga jeep or bus, especially po yung mga gumagamit ng taxi or yung mga hire na vehicle, is it safe pa din po ba na magtanggal ng mask? Kahit na konti lang yung mga pasahero na sumasakay po doon.
May narinig lang kasi akong balita na mas required kasing gumamit ng mask sa mga tren. Mas madalas akong sumakay kasi ng jeep. Dapat nga mas required na gumamit ng mga mask doon sa may jeep sa mga publikong sasakyan kasi mas maraming tao doon at mga nagsiksiksikan at mga nag-aabutan ng bayad. Ang tanong ko lang kasi, paano ko masisip ang sarili ko kung doon hindi required na gumamit ng mask? Mas maraming ang tao doon eh. Kaya tuloy, nagdadalawang isip na ako na sumakay ng jeep.
Okay, thank you very much, TVUP. And so we have 3 questions. They're all related to transport. And what we wanted to do was to ask our guests to answer, just go ahead and answer, or it's a conversation. So who wants to take that question? The first one is about a jeep. The second one is mga enclosed taxi o yung mga
Transportation related, opo.
Tapos yung third, jeep din ang tanong. Sige, go ahead.
Ako na lang.
Sige,
Yes, Ma'am Isa, go ahead, ma'am.
Go for it.
So, for transportation, mas safe na mag-mask, no? Kasi lalo na hindi ka pwedeng mag-distance, no? Sa jeep. Full capacity na yung mga natin, 'di ba? Transportation ngayon. So it's safe to wear a mask. So yung tanong kanina nung yung isa, di ba, yung train, jeep. So I would advise na kahit anong mode of transportation, mag-mask kasi nga you're not in enclosed space siya eh. Tapos tabi-tabi kayo. And then you're not sure kung yung katabi mo may symptom or as mentioned na kahit walang symptom, pwede pa rin makahawa, di ba? So it's safe. So yung recommendation sa public transport is still to wear mask.
Paano kaya yung mga school bus?
Medyo iba yung situation ng school buses, no, Ma'am Susie, kasi although it is public transport, in a way, it is a bubble. Kasi pare-pareho yung kasama natin sa araw-araw. So, sana, no, unang-unang dapat isipin, I suppose similar situation na sa employee shuttle, no, o yung mga carpools. So, ang unang-unang dapat tandaan ng mga sumasakay ng shared vehicles, kahit na regular sila, carpools, school bus, shuttle ng kumpanya, tandaan natin pagka hindi maganda pakiramdam, wag nang sumakay, no? Kasi it's really that awareness of how you're feeling that should be the trigger of all of your subsequent actions. If you're not feeling well, then let's not take the chance of potentially infecting other people with COVID or something else, kasi di lang naman COVID ang nakakahawa di ba? So sa school bus, ganun din. Dapat yung mga magulang medyo aware na bago pa sakayin yung bata, they should be okay. Now, I would suggest, no, pwede kasi sigurong mag-mark na sila ng seats. Parang dapat ito lang yung upuan mo. Lalo na siguro kung mga several rows yan, hindi yung harapan. Pwede bang magtabi-tabi na lang na nakamarka? Para alam mo, pagka magko-contact trace ka eventually, let's say, uy nako, 2 days down the road, nalaman ko may sakit pala ako. Alam ko na kung sino parati yung katabi ko. Hindi ko na iniisip na kailan ko ba nakatabi tong batang to nung Wednesday. It will make things simpler, no? So baka pwedeng isipin niya ng mga transport services na i-assign na yung seats para hindi nakakalito kung magko-contact trace. Yung nabanggit kanina about making sure there's ventilation is very important. And of course, pag hindi mo kasama sa bubble sa bahay, kailangan nakamask ka.
Parang yung sa aeroplano, di ba? You have an assigned seat so that you can trace. I think that's a great idea. Rob, let's ask that question around yung taxi. So let's say you get into a taxi. Ikaw lang mag-isa, okay? And let's say the driver's not sick, but a previous passenger, had COVID.
Hindi ko po sinisipan.
Whatever. Oo. Ano ba maganda gawin pagka ganun, pag taxi, mga public transport na isa-isa lang naman ang sumasakay?
Yeah, technically, Doc Susie, ano pa rin sila, no? They might be from semi-private, pero actually public pa rin sila if we consider it because it's being used by other people din naman. As mentioned earlier kasi, it's still enclosed, lalo na ngayon mainit, so nag-close talaga, naka-aircon. We might see, kung nag-grab ho kayo, meron parang plastic barrier, but I don't think that it's very, very effective in blocking transmission. So I would say that I think Ma'am was also referring to this earlier, that we really need mask pa rin in these situations. But I think another measure naman, kasi it's more controlled, we can actually, some grabs have yung alcohol or yung air sanitizer to disinfect their vehicle before the next passenger comes in. No? But I think it's really safe to say na kahit walang symptom yung driver, walang COVID, remember, yung other passenger can, baka na-infect siya ng previous passenger and pwede talaga ma-transmit yun. So it's really safe pa rin to wear mask, even if we think na ako lang mag-isa dito, walang kasama. So yeah.
Okay. All right. Let's go to our second set of questions. Na dun sa ating Ask the Expert. Go ahead. You have a question. You wanted to ask something.
On the point of our last viewer, yung binabanggit niya na nabalitaan niya na hindi mandated in one setting, mandated in another setting. Siguro ang magandang i-emphasize is hindi pinagbabawal ang pagsusuot ng mask. Sinasabi na pwede ka nang hindi magsuot, which is a totally different thing, di ba? So ngayon, yung responsibilidad at saka yung pagkikilatis nasa atin. Isipin natin, saan ba tayo magkakaroon ng possibility of exposure. And syempre, kung may possibility, hindi ba dapat proteksyonan natin yung sarili natin? So tama yung iniisip ng ating viewer eh. Hindi nga ba sa jeep mas tabi-tabi? Hindi nga ba sa jeep nag-aabutan kayo ng pera? Hindi ba dapat sa jeep nagsusuot ng mask? Ang sagot doon, yes. Tama yun. Tama yung naisip mo. And in fact, dapat, no, ganun tayo mag-assess. Are we in a situation where it puts us in danger? And if the answer is yes, or if you have any doubts, may mawawala ba pag nag-mask ka? Wala naman, di ba?
Oo, when in doubt, mask. Okay, let's go to our next. Nice point, Anna. Let's go to our next set of questions. TVUP, please.
How prepared are school clinics to address any COVID outbreak in case that happens?
How can you ensure that proper protocols will be followed by parents and students and the teachers when everyone goes back to the regular schedule of classes?
Ang concern ko is merong nagsa-circulate sa Facebook na post which shows or sinasabi na na may tendency yung mga children na maghiraman ng mga mask nila. Paano nyo may explain sa mga bata kung gaano ka-importante ang paggamit ng mask as simple as possible para maintindihan nila, pero at the same time mag-stay ito sa kanila.
Okay, another interesting set of questions. Sige. Who
Schools
wants
naman
to
po,
go?
schools naman.
Schools naman. Parang si Ana yata to eh. Sige. Schools kasi mga bata. Pero
Lalo na po how do you explain po to the children? Kasi yung mga children pag madalas sila magsalita, madaldal, gumagalaw daw yung mask nila pa ba? So parang hindi daw nila kasalanan yon. Yung mga ganun po, how do you relate to those?
Raymond, maganda yung huling tanong eh. Yung naghihiraman. Dapat
Yun.
siguro parang ano yun eh. Parang toothbrush yan, hindi pwede maghiraman or underwear. Diba? Sige, Ana, go ahead.
Alam mo, natutuwa ako dun sa last question kasi I remember, naku, maririnig ng mga anak ko. But when my kids were small, they were saying na, Ma'am, pwede bang dagdagan yung baon namin? Kasi what they do daw pala is nagbubuffet sila, nandun sa gitna ng mesa, tapos kuha ko Kaya diba? I can imagine those settings where sineshare mo nga yung pagkain mo eh, maano ba naman mag-share kayo ng mask? Pwedeng mangyari. So, I think it's very important for parents, no, na i-orient yung mga anak nila na ang mask hindi pwedeng hinihiram at hindi pwedeng pinapahiram. Kung gusto mo magdala ka ng extra, bigyan mo sila, pero dapat bago. Kasi nga, syempre may mga laway yan, baka pwedeng maging source ng hawaan. And then of course, school community kailangan i-reinforce din yan ng mga teachers and staff. Now, yung tanong about how ready are schools, no, and how can schools ensure, I think, of course, there's a responsibility for the school administrations to put in place these protocols and unang-una intindihin, no, yung science behind it para kung gagawa man sila ng protocols, yung reasonable at saka science-based. Now, I understand that's very challenging, no? Pero let me share one document. No? Meron namang JMC, yung Joint Memorandum Circular, yung DOH and Department of Education that summarizes all of these recommendations that schools can use as a basis for their protocols. And marami tayong mga school health physicians and school health officers who are very well versed in understanding of COVID transmission science na pwede naman nilang i-consult. And of course, sa amin naman, sa community ng infectious disease and mga pulmonologists, we're always ready to answer your questions. No? It's very easy to reach out to us kasi our communication channels are easy to access now, lalo na meron tayong mga social media channels. Now, siguro aside from that, no, the role of the administration in understanding transmission and translating this to protocols, nandoon din yung role nung members of the school community, no? Ang ganda kasi sana kung yung mga families, the parents who are part of the school community can also get together to help each other, no, protect their kids. Particularly I would think in more close-knit communities nakikita natin to, no, na tayo mismo ang nagbabantayan para hindi magkahawaan yung mga bata. So malaki talaga ang personal responsibility. Lalo na ngayon na natututo na tayo to live with COVID.
Thanks, Anna. Isa, you wanted to say something?
Yeah, just to add yung sa question on how to implement itong mga standards. I think one good practice is to assign safety officers sa school, who will magro-rotate yan, to check, ensure that the standards are being followed, yung windows, and then yung mga nakamask, ang mga bata, yan. So having that safety officer, to check on the policies that were created, by the school administration. I think it's one way to, yung din mag-check din, di ba, na to ensure na yung mga batang pumapasok walang mga symptoms. So merong taga-check niyan.
Yeah, I think I don't know, parang depending on the age of the kids. I would think the younger kids, it's really the teacher who's the key, and the family would be key, no? But as the kids get older, yung responsibilities nila in school probably are a little different. So do we have any guidance on that? Kasi iba mag-isip yung grade 7, di ba? Compared to the grade 2. No, so ano kaya do we have kind of like guidance on this based on the developmental stages or the age of the kids? Because it's quite different, di ba?
Yes, Ma'am Susie, I agree, no. There's of course the factor of understanding what the instructions are as a factor in influencing compliance. Unang-una, I think it's also very important to understand that we don't recommend mask wearing for children under the age of 2, because the assumption there is if they're not verbal, they won't be able to tell us if they're having difficulty breathing with the mask, and therefore that might endanger their health, no? So yun lang yung principle. Iba-ibang standards, may mga bansa na 5 years old pababa ang kanilang limit. That's WHO is 5, the AAP is 2 years old, and then in other countries they actually set it higher at age 7, no? So sa atin, we choose to use the 2-year-old cutoff, and that's been in place since the start of the pandemic. Now, I also agree that the people around these kids, the smaller kids, really play a big role, no? Kasi they need to be reminded that mask wearing is important and needs to be done consistently. Pero it's so surprising, di ba? We always hear about kids being influenced by teachers very greatly. And in fact, pagka minsan nagtatalo yung sinabi ni mommy o sinabi ni teacher, minsan nananalo yung sinabi ni teacher. And you'll be surprised that the compliance of these small kids is pretty okay. Lalo na sa school setting kasi alam nila rule yan, sumusunod sila. So, ano lang yan, siguro implementation and of course modeling.
Yeah. Okay, let's go to our third set of questions. TVUP, please.
Katulad ng ganyan, Dok, mag-holiday, Pasko at Bagong Taon, kailangan pa ba namin ituloy yung pagsusot ng face mask o mag-ingat na lang kami?
My question would be, what are your plans in case the cases goes up again?
And my other question is, what's the most effective type of face masks? Because since 2020, we've been exposed to like different kinds of 3N, various masks. So what's the most effective that we can use?
2020, we were just advised to wear masks in order to protect us from COVID-19. There are few to no guidelines regarding how to properly wear it. How do we properly wear and dispose a mask? And how many times can we wear the same mask?
Okay, I think some of those questions are for Ralph. Ralph, kunin mo yung, yung kind of mask.
Yeah. So what kind of mask po? If we're technically speaking, it's really the respirators that are the most effective, no? But we have to, yung
For the
mga
general
N95,
public, Dr. Ralph.
N95, yeah. But we have to understand po na hindi unlimited yung supply noon. So we are actually advocating kahit po the regular na medical grade surgical face mask, no? So that is one of the advocated and the best to use face mask. And we have to use it only once as much as possible. Hindi po siya yung nahuhugasan na unlike the cloth mask na sinabi ni Dr. Raisa kanina na 2 layers of cotton, we can also use that. But in hierarchy, the surgical mask is better, and then after that would be the cotton kung wala talaga or the supply is low. So we cannot. I have to reiterate. It's usually it's most of the time po disposable yung ating mask, surgical face mask, and we have to remember that we should doff it. Doffing is as equally as important as wearing it on. No, so we have to remove it carefully then without touching the outer surface because it's the outer surface that is contaminated. So we have to throw it away without touching it, because sometimes if we touch the outer surface and then touch our eyes or nose after that, so medyo delikado din yun. So yes, surgical mask and then cloth masks can be used, and cloth masks, some are reusable and washable, so we can also use that. So mas practical yun for most of us yung cloth mask kasi pwede siyang gamitin ulit.
Thanks, Ralph. Isa, ano daw gagawin sa Pasko? Magpa-party na naka-mask.
Okay, yan. Pwede pa rin tayo mag-party, no? But yun lang. So first, you need to assess or tanungin yung mga elderly natin, yung mga may sakit, no? Diabetes, ganyan, yung mga immunocompromised, sila kailangan nakamask when attending the gathering, no? So assess yung status. Tapos kung may unvaccinated din, then yung mga kailangang magmask, dapat magmask, no? So unvaccinated, tapos with may mga sakit, no? Tapos kasi nabanggit din nga ito tapos kung yung halimbawa naman hindi pwedeng magmask yung may sakit kasi hirap huminga, then tayo yung magmamask kasi para maka-attend pa rin, no? Ng party. So you have to assess it both ways, no? Tapos kailangan din reminder na pag nag-party walang may sakit, walang may nararamdaman, no? You have to inhibit or wag mag-attend ng party kung may nararamdaman. Okay. And then yung space, yung area kung saan gagawin yung party. So i-check natin yung ventilation, yung airflow, kung pwede magbukas ng bintana o maglalagay ng electric fan, portable air purifiers, no, air cleaners, no. So yon. So to make it safe para yung party natin ay safe para sa lahat. Okay.
Isa, I have a question here related to that na ano kaya kung bago mag-party, kunyari family reunion, ay magpa-antigen test muna sila. Pwede ba silang hindi na mag-mask during the party?
Yeah, in a way. Kasi at that point, for that day, no? Kung gagawin mo yung
for
test.
that day.
Oo, during that day. So kung negative, pwede naman na hindi mag-mask.
Okay.
Kung everyday palang party, everyday din ng antigen, ma'am.
Oo, kasi yung
Parang gano'n na nga yun.
Yung resulta is as good as that day. Pero kung
that's
hindi
an option, no? That's an alternative, no? If
an
they can afford it.
alternative, oo. And if it's a good quality antigen test.
Yeah. Okay, we're running out of time. I think
Comment from Dr. Ana, Dr. Susie.
Sige, Ana, go ahead.
So I think na-cover nga ni Isa, no? As long as it's a good quality antigen test. Kasi alam naman natin that the sensitivity for antigen tests can be quite low, especially in the context of no symptoms. Kasi ba't ka naman magpa-party kung may simptomas ka, di ba? So I guess the baseline patient profile there is, I'm feeling well, but I just want to be extra careful. So medyo tosko yun. Swerte ka lang kung may makuha ka, kung meron kong mag-positive, pero kung negative, it doesn't really mean anything. My take.
Okay. Okay, so we are out of time and Raymond will have to go to our questions. Sige, si Isang nagtanong nito kaya siya sasagot. Game.
Okay. Meron po tayong dalawang katanungan. Yes, okay. Slido naman. First question, Ma'am Isa, what are the situations that call for wearing a mask in the community, ma'am?
All of the above.
All of the above. All of the above. Okay.
Tapos
Okay.
actually merong nagtanong kanina na kulang daw yung choice natin yung kung meron ding bata na or baby na hindi bakunado sa bahay.
That's a
Kailangan
good
nakamask din. Oo.
Good point. Good point.
Yes.
Thank you, ma'am, for our second question. Mukhang multiple choice din po ito. No? What are the best practices for prevention of respiratory infections in schools?
Lahat ito ay best practices for preventing infection. So this is a package of preventive actions.
Okay, well, good to know that people have this good sense po, no? Ventilation, dati po kasi hindi masyado na pag-uusapan yung ventilation. Ngayon, 93% na, medyo mataas-taas na po ang nakakaalam. And then stay home if you are having any symptoms. Although medyo mahirap yata tong no crowding at saka kasi hindi po sila masyadong mataas ang ating score, at least for this one po. So okay. So we are at 128. Dr. Susie.
Teka, Raymond, bago tayo mag-proceed with evaluation. Our speaker next week is Dr. Lito Gapas and he's raising his hand. He has a question.
Oh, okay. No problem.
I'm wondering if we can allow Lito to speak.
Okay, okay.
TVUP?
TVUP, can we
Lito Gapas.
Can we promote Dr. Gapas as and then he could ask his question?
Kasi nag-raise siya ng hand speaker natin yan next week, baka hindi dumating pag hindi nakasalita.
Andiyan na yan. Dr. Lito.
Lito, welcome.
Yes, Susie, just a very short message kasi we're talking about masking and we have to talk about the workplace perspective. Nakakatuwa kasi yung DOLE, nag-release na sila ng advisory on workplace. Basically, sinasabi nila, before you decide on indoor masking, magawa kayo ng risk assessment. Dahil sa workplace, hindi lang naman health ang tinitingnan. Sa community kasi, kung meron kang infection, you go on home quarantine and play Netflix or watch Netflix. Sa workplace kasi, marami kaming tinitingnan. Number one, baka maubusan ng tao. Pangalawa, makakaubos yun kasi we do contact tracing. So hindi lang isa ang mawawala. Pangatlo, meron kaming day workers na no work, no pay. Paano sila? Mawawalan din sila ng trabaho. And pang-apat is, marami rin kaming workers na customer facing. Na yung mga customer mo, may nagmamask at merong hindi nagmamask. So yung ginagawa namin pag ganyan, hindi lang naman sa worker yung focus, pero yung customer mo. So we have to think very clearly about masking in workplaces. That's all. Thank you.
Uy, thank you very much, Lito. Parang parang teaser, Raymond, patikim. Next week, si Lito
That's correct.
natin, maganda. What is the risk? How do you assess the risk in the workplace? And it's different with different sectors and industries, So thanks a lot, Lito, for that perspective.
Thank you.
Maganda. So we look forward to listening to more of your insight on that. Okay, Raymond, let's go to our evaluation.
Okay, while we're doing the evaluation, we'd like to take this opportunity to thank all of our speakers po, Dr. Alejandria, Dr. Villalobos, and Dr. Ong-Lim, all the way from Melbourne. Maraming salamat po for joining us, Ma'am Ana. We'll give you a few minutes po to compose so that you'll be able to come up with your final messages to our audience. But while we're doing that, ito po ang ating 5 katanungan. It's a 4-point Likert scale. Wala po kaming ibang inilalabas na evaluation link. Ito lang po iyon. So we hope everyone will be able to participate. First question, panelists demonstrated thorough knowledge of the topic. Number 2, panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues We will not be closing this evaluation poll until the end of the webinar as we move on to the final messages from our speakers. Dr. Susie.
Thank you very much, Raymond. And thank you for participating in the evaluation. This is very helpful for us. Okay, let's go to Anna muna, all the way from Melbourne, Australia. Anna, what is your parting message?
I'd like to focus particularly on the issue of masking in schools, and sana matandaan no ng ating mga magulang at mga estudyante na ang pagsusuot ng face mask ay mahalagang karagdagang layer sa proteksyon na dapat nating pakinabangan. So, meron namang pwede pang gamitin para makadagdag sa proteksyon natin against COVID. This is something that we should be benefiting from, and with consistent and correct mask use together with all of the other layers of protection including vaccination, ventilation, distancing, sana maging maayos no ang pagbabalik ng mga estudyante sa klase.
Thank you very much. It's Dr. Annalisa Ong-Lim, all the way from Melbourne, but from the Department of Pediatrics of the Philippine General Hospital. Okay, Dr. Ralph, go ahead. Your turn.
Yeah, so short lang po. So I think here it's very, very important that we have to educate our people, our patients, and the public know that it's very, very important for them to understand the benefits of masking and what would be the proper, it's not a one size fit all. You have to wear this particular type of mask. This is the best mask. So that some kind of mask might be better for you, or you can use it more than the others. Well, so it's really important to to individualize the advice to our patients if they have to wear masks. Thank you.
Okay, thank you very much, Dr. Ralph Villalobos, pulmonologist at the Philippine General Hospital. Okay, let's go to our main speaker, Dr. Isa Alejandria. Isa, what are your parting words?
Sa akin, let's sustain the lessons we learned from this pandemic. So I think this pandemic help us learn, go back to healthy behaviors, yung basic healthy behaviors, washing our hands, not going to work if you are sick, wearing mask, so sana ma-sustain natin tong healthy behavior na to, not just because of COVID, but because it will also prevent other respiratory infections. So let's continue to work together so that we will have a safe environment, school, sa work, sa bahay, So i-sustain natin tong paghuhugas ng kamay, pag-wear ng mask kung may symptoms, may nararamdaman, tsaka yung mga may sakit. And I think next week, i-emphasize ni Dr. Gapas yung how to make our workplace safe din, not just again for COVID, but for all other diseases. And hindi lang naman sa infection, as Ralph mentioned kanina, di ba? The mask can protect us also from pollution, then other respiratory diseases. So yun lang, let's sustain our healthy behavior.
Okay, thank you very much. It's Dr. Isa Alejandria, who's the head of the Clinical Epidemiology Unit of the National Institutes of Health, UP Manila. Okay, Raymond, let's go to the survey results.
Okay, can we have the evaluation? Yeah, there we go. So for our evaluation po, very well received. So at least 94% of all of those who participate in evaluation poll really strongly agree with all of the statements. So maraming salamat po talaga. This is really a testament of all the things that they learned from all of the speakers po. And thank you for sharing your knowledge in today's webinar. Dr. Susie.
Thank you very much. Okay, so again, thank you to all our speakers. We'll have a brief synthesis by our Deputy Director for Health Operations at the Philippine General Hospital, Dr. Stella Marie Legaspi Jose. Stella, over to you.
Good afternoon, everyone. We have a very interesting and enlightening lectures from all our speakers, Dr. Isa Alejandria, Dr. Ralph Villalobos, and Dr. Anna Ong-Lim. Dr. Isa Alejandria, in her first slide, she said the topic is to mask or not to mask, but she already answered her question, and she said we must wear a mask when we are indoors. Okay, so she said that the cases are decreasing. However, we have the emergence of the variant strains this means that transmission of the COVID-19 infection is still ongoing. She reviewed the mode of transmission of the COVID-19 virus, and she said it can be inhalational or aerosol or droplet. It can be deposition of the respiratory droplets on exposed mucous membranes. For example, somebody coughs in front of your face. Or number three, touching of mucous membranes with the hands. So you touch your nose or your face with or in contaminated surfaces. She said that we should improve ventilation in closed spaces. And for example, just the simple electric fan, you can, in a closed environment, you just direct the electric fan to the windows, no? So point it outside and do not point the electric fan near the face of a person. So she said that there are factors that lower or increase the chances of infection. So first, she said more than 15 minutes in an enclosed surface, in an enclosed space would increase the chance of infection. Coughing, sneezing, or singing or shouting can increase the chance of infection. If both of you are wearing a mask, the type of mask, and if it's well fitted, this decreases your chance of infection. And of course, distance. When it is a crowded place, the more likely that you can get infected. So she said that wearing of mask is an individual choice, but she admonishes us that the following should really wear masks. If you are elderly, 6 years old and above, immunocompromised, or you work in a closed environment, for example, in closed classrooms, and if you are unvaccinated. Dr. Ralph Villalobos, a known pulmonary specialist, said that there is evidence that face mask decreases the chance of infection. Okay, because COVID can be transmitted even by an asymptomatic individual. And face mask offers benefits, especially in patients, and he saw this in patients with asthma and COPD. Now, the change in the behavior of the virus, also mask effectiveness decreases the possibility of infection of the Omicron variant. So let us be cognizant of that. And wearing a mask is generally safe. However, he mentioned that patients with severe COPD, sometimes they may have difficulty in inhaling when they are wearing a mask. But still, he said, as Isa has mentioned earlier, wearing a mask is really a voluntary option. Now, Dr. Anna Ong-Lim, she mentioned the interesting part of her lecture is because she focused on children and the school setup. She said that in the school setting, the children must be vaccinated and they should clean their hands. The windows must be open. And for example, the used tissues and masks should be thrown in closed bins. There should be physical distancing of at least 1 meter, and the child must stay home if she doesn't feel well. And so why is masking advised for children? Because children can get critically ill also, like in the adults. Okay, back to you, Susie.
Okay. Thank you so much, Stella, for that very concise summary of our discussion today. And we are looking forward to the discussion next week. So, Patikim, nakilala nyo na si Dr. Lito Gapas. Actually, we had him before. He is the head of occupational health of First Philippine Holdings Corporation. And our topic is going to be how safe is your workplace? Anong pananaw ng pribadong sektor? So be with us next week. We get more ideas about how to look at this from the point of view of the workplace. Okay, Raymond, over to you.
Thank you so much, Deputy Director Stella, and thank you, Dr. Susie. Before we close our program, we'd like to take this opportunity to thank the very hardworking team behind the Stop COVID's webinar series. Without each and every one of you, we won't be able to churn out quality content each and every week. So maraming salamat po sa inyong lahat. Also, remember that all Stop COVID's webinars are archived for viewing at the TVUP YouTube channel. You just go to www.youtube.com/TVUPPH for you to be able to see all 124 episodes. And then after the day, it will be 125 episodes that will be in there. And then also, what we have created po is what we lovingly call the SCD shorts. Ito po yung mga very short videos, consumable po, really going straight to the nuggets of wisdom po, So if you have the time, maybe nakamas po kayo habang nasa trend, maybe nasa jeep po kayo, nanonood po kayo nun. Kung meron po kayong pagkakataon na mapanood po ito, please go to youtube.com/TVUPPH and you'll be able to see all of our, not just the webinar episodes that you can see in the playback, but also ito pong SCD shorts po natin. So this formally closes our webinar for the week. Makita-kita po tayo ulit again sa ating next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.